A health alert. The Arkansas Department of Health reporting flu activity in the state has reached a very high level. The latest weekly report showing 5 more people in the state have passed away from flu complications, and thousands of Arkansans have tested positive for the flu since early October. Our Tylisa Hampton live this evening at the Arkansas Department of Health. Tylisa, what did doctors there have to say about the rise in these flu cases?
Well, yeah, Kevin, a doctor with the Department of Arkansas Health says there's a number of reasons why these flu cases have reached into the thousands, some of which include COVID. But he does say there are many steps Arkansans can take to prevent getting the flu. 28-year-old Lamaya Hatchett was diagnosed with the flu this past Saturday after she didn't feel well.
Body aching, headache, fever.
Hatchett knows how she got it.
My daughter has it as well.
Dr. Joel Tomlinson with the Arkansas Department of Health says flu rates are very high compared to this time last year. In the department's weekly report, there were 276 new influenza cases in the past 7 days.
The highest percentage, over 50%, almost 60%, are actually children, 17 and under. So the biggest portion of that is school-age kids, but also 0 to 4-year-olds are also getting it in high numbers.
The report also shows since October 2nd, more than 5,000 Arkansans have tested positive for the flu.
There were low rates of influenza in previous flu seasons, the last 2, so people don't have as much leftover. Low rates of immunity that they might have had from having a flu infection last year. Also, people are taking fewer preventive measures,
which he says includes
wear a mask, wash your hands lots, try to keep your hands and fingers out of your nose and mouth.
He says there's also a reason why there was a rise in deaths.
Is it common to have 5 in 1 week? No, but that is in line with the increasingly high rates of influenza we're seeing in the state.
Suggesting everyone should get the flu vaccine and stay at home if they have the flu. Hatchett and her daughter are not taking any chances.
We were in separate rooms. We ain't seen each other.
Well, he also says if people feel like they have the flu, they should go ahead and get tested. Some of those symptoms include a fever, muscle ache, and cold-like symptoms. Now, he says it's not too late to get the vaccine because these high number in flu cases could last for months. Reporting in Little Rock, I'm Tylisa Hampton. Back to you.